The electrophysiology program here, there's a lot of facets to it. One of them is dealing with patients who have congenital heart disease, who have arrhythmias either pre-op, post-op, and that includes adults with congenital heart disease who are an especially challenging population. A lot of them develop potentially life-threatening arrhythmias later in life, and we deal a lot with them. Another component of our program is inherited arrhythmias, and that effort is being spearheaded by Dr. Dominic Abrams and his group. So we try to address a lot of different things, and it's evolved. We did not have the availability of things like catheter ablation when I first started in this business, and it's become a central part of our mission right now.
So the Inherited Cardiac Arrhythmia Program was founded in 2011 and is a dedicated clinical service for families and individuals affected by all different forms of inherited heart disease. And that can be highly varied from purely electrical disorders to forms of structural heart disease, usually involving the muscle of the heart. So we've taken an approach here in Boston where the family becomes the unit of care rather than individuals. And that's fundamentally important because we need to identify all family members who may be at risk of inheriting different forms of heart disease. And therefore we care from all patients from the cradle through to older life. And we do that by creating a joint program between Boston Children's Hospital and the cardiovascular program, Brigham and Women's Hospital. Many of the patients that we care for have very broad and deep clinical needs, and really to provide that and to address those, we need a multidisciplinary approach with numerous different team members who all play very unique and individual roles in caring for the family. That can include a genetic counselor, a clinical psychologist, a program coordinator, and a nurse specialist, all of whom integrate with the family in different ways and really allow us to provide an overall and holistic approach to their care.
I started in 2012 as the first trainee of the Inherited Arrhythmia Program, and have been one of its founding members along with Dominic Abrams since its inception. And this program is really critical to both the overall mission of the electrophysiology department, as well as the ability to translate what we do in the lab to what we do in the clinic. The ability to have patient-specific samples and well-characterized patients is absolutely critical for us to be able to develop new novel therapies for patients who have inherited arrhythmias and other types of cardiac disease.
In the ablation program, we learned very early on that anatomic definition of what we were dealing with was crucial, so we are fortunate that we're at an institution with a great surgical program, a great cardiology program that allows us to import anatomic information for our ablation procedures from the catheterization lab, MRI lab, the surgical experience, the cardiac registry where we have pathologic specimens that we can look at, and it's really given us a leg up in complex ablation.
The special problems that we have become exceptionally familiar with and developed a lot of expertise with involve the types of very fast heartbeats or tachyarrhythmias that are associated with kids who've had heart surgeries. Most commonly, these are forms of atrial flutter, or what we call intraatrial reentrant tachycardias. They occur in a large percentage of patients who have complex heart disease. Over time, they can become quite debilitating, and they require special techniques and technology to treat them here in the cath lab. So examples of the technology which we have learned to make good use of in treating these patients includes mapping of the heart in three-dimensional space using position-enabled catheters, the use of special techniques for providing ablation lesions to the heart, the use of rapid mapping techniques using multi-electrode catheters that allow us to learn a lot about the muscle tissue of the heart and how the arrhythmias propagate in that sick and diseased tissue.
I primarily am overseeing placement of pacemakers and defibrillators in children and adults with congenital heart disease. They're a little challenging. I think kids are different from adults getting devices, just they're smaller, and especially with our congenital population, they have different defects or different anomalies that makes putting in devices more challenging. I think one of the biggest challenges currently is figuring out resynchronization for our patients, which is just figuring out how to make their ventricles squeeze in a more synchronized fashion with their pacemakers and optimizing the squeeze of their heart.
For the future, we want to be able to keep doing what we're doing now, but doing it better. This is particularly so in catheter ablation. In complex anatomy, the results are not as good as they are in normal hearts, and some of the arrhythmias are more complicated. By being exposed to more patients and trying new technologies, those results are constantly improving, and we want that to continue.